Acid reflux is a common problem with about 3 million cases recorded in the United States alone. If you are sounding a little hoarse and have a sore throat, you may be bracing for a cold or a flu. But if you've had these symptoms for a while, they might be caused not by a virus but by a valve, your lower esophageal sphincter. That's the muscle that controls the passage between the esophagus and stomach, and when it doesn't close completely, stomach acid and food flow back into the esophagus. The medical term for this process is gastroesophageal reflux. The backward flow of acid is called acid reflux. A few lifestyle changes may be worth trying before resorting to drugs for controlling gastroesophageal reflux. Here are a few ways to improve your situation. As a disclosure, we are not medical professionals or health experts, and these videos are for entertainment purposes only. First up on this list is stop overeating. Unsurprisingly, most reflux symptoms take place after a meal. It also seems that larger meals may worsen reflux symptoms. One step that will help minimize acid reflux is to avoid eating large meals. If it fits into your schedule, you may want to try what is sometimes called grazing, eating small meals more frequently rather than 3 large meals daily. Number 2 on this list is avoid certain foods. There are some foods that are more likely than others to trigger reflux, including mint, fatty foods, spicy foods, tomatoes, onions, garlic, coffee, tea, chocolate, and alcohol. If you eat any of these foods regularly, you might try eliminating them to see if doing so controls your reflux, and then try adding them back one by one. Number 3 is quick. Avoid drinking carbonated beverages. They make you burp, which sends acid into the esophagus. Drink flat water instead of sparkling water. Number 4 is consider losing weight if needed. The diaphragm is a muscle located above your stomach. In healthy people, the diaphragm naturally strengthens the lower esophageal sphincter. As mentioned earlier, this muscle prevents excessive amounts of stomach acid from leaking up into the esophagus. However, if you have too much belly fat, the pressure in your abdomen may become so high that the lower esophageal sphincter gets pushed upward, away from the diaphragm's support. This condition is known as hiatus hernia. Hiatus hernia is the main reason obese people and pregnant women are at an increased risk of reflux and heartburn. Next up on the list is to consider following a low-carb diet. Growing evidence suggests that low-carb diets may relieve acid reflux symptoms. Scientists suspect that undigested carbs may be causing bacterial overgrowth and elevated pressure inside the abdomen. Some even speculate this may be one of the most common causes of acid reflux. Studies indicate that bacterial overgrowth is caused by impaired carb digestion and absorption. Having too many undigested carbs in your digestive system makes you gassy and bloated. It also tends to make you belch more often. Supporting this idea, a few small studies indicate that low-carb diets improve reflux symptoms. If you found this information helpful, at the cost $0, hit the like button and subscribe to our channel.